In a move aimed at addressing the alarming shortage of healthcare professionals in Nigeria, President Bola Tinubu has unveiled a new policy to bring back 12,400 doctors who have left the country, commonly referred to as Japa doctors. Now, this initiative comes at a crucial time when the healthcare system is grappling with a significant brain drain, leaving hospitals understaffed and patients underserved. The policy's success could mark a turning point in revitalizing Nigeria's healthcare sector, but it also raises important questions about the factors driving doctors abroad and the sustainability of keeping them in the country.
Now, the exodus of medical professionals has been a growing concern, with many doctors seeking better working conditions, remuneration, and also opportunities abroad. As the government seeks to reverse this trend, the focus now shifts to how these returning doctors will be reintegrated into the healthcare system and whether this move will address the root causes of their initial departure. The stakes are high, and the outcome of this policy could have far-reaching implications for the future of healthcare in Nigeria. So joining us today to discuss this critical issue are Professor Mohammed Pate, Minister of Health, Dr. Olowjebutu Benjamin, First Vice President of the Nigerian Medical Association, and Dr. Nene Ajibade, a practicing doctor. Welcome to the show.
Thank you for having me. Good morning to you.
Good to have you here. And also let's welcome Dr. Nene, who's on live view with us. I'm hoping that she is with us now. Well, I'm sure that we'll get that communication sorted. But good to have you in the studio here.
Thank you for having me again.
First off, right off the bat, let's ask, what persists when it comes to doctors choosing or preferring to work outside of Nigeria? What are the persistent causes and perhaps maybe policies that make them see this as more attractive than being here?
Obviously, we all know that one of the major things you go to school for is to be able to feed your family after finishing school. But it's not the same thing now in Nigeria because all the stress you go through medical school and stuff and training, you don't get commensurate value for it after you finish. And it doesn't give you the quality of life you want to enjoy. That alone affects the quality of life, and people want to go to where they are appreciated, where they are celebrated. I'm sure you heard about the few of doctors being kidnapped in the country, insecurity, no adequate remuneration. You know, it's just all very tacky. Now look at this policy, 56 pages. I read them back to back. You know, nobody talked about how to increase the welfare, the salaries of medical doctors or healthcare professionals. You were just very focused about reintegrating those that are coming from abroad. The value for this thing, there are push and pull factors. The economy there is very sane climate, very good working condition, enabling environment to work, to express yourself, talent are wanted there. But where we are in this country, there's no value for what we do. So if you're going to write policies and you don't put the real important issue on welfare, on healthcare insurance, on security, on value, on enabling value, on working hours, on explaining to the patient that we serve that if we have 10 doctors seeing 10,000 patients before, and then now 5, what you should do is to tell the patient that we can't do 10,000 doctors anymore. We only do what? 5,000. But a lot of the CEOs are focused on income generation, not adding value to the people that are putting the work into it. So you are still 5 doctors in the same department, still seeing 10,000 patients. So doctors are dying, they're having morbidity, they're not efficient anymore. There are some kind of mistakes because they are overburdened, overworked. It's not addressed in the policy. So for me, how was the policy written? Was it written from a context of an outsider or a context of an insider, somebody rooted in the fabrics of the healthcare space in this country? Very, very important. Because for me, the focus of this particular policy is for people to drive in back from outside the country, not stay back in the country.
Make it attractive for them to
come back. But you must first keep those that have labored in vain in this country, make them feel welcome to the country, and keep them here first before people start coming back here. Because people only come back when they say that those that are here are thriving. They can buy a good car. They don't have to buy a second-hand car at 65 years old and they think they bought a new car. You know, there must be joy in what they are doing.
Okay. We're being joined now by Dr. Nene Ajibade. She joins us live via video chat. Dr. Nene, I want to say thank you so much for joining us this morning. If you can hear me, Doctor.
Yes, I can. Can you hear me?
Loud and clear. We said thank you so much for joining us. We just spoke to the first vice president here in the studio, and he's telling us about, the policy that is being approved by the president for Japa doctor. And he was saying, that for things to be better, they also need to look at the doctors that are here walking in vain, quoting him there, that for them to improve the conditions of the doctors here. Let me ask you, you are a doctor who had to opt out of Nigeria to go work abroad. And for that to change, for you to come back, what do you want to see change with the system if you were to come back?
Thank you, first of all, for having me here this morning. The question really is, what is on ground for us to return to? I like to applaud the policy because it shows that somebody is thinking for a start. But I believe that there is a lot to be done still. And I agree with Dr. Benjamin. If I am going to return to Nigeria, I need to find out what is on ground. And basically, the major things I want to see is security, rooms for professional development, opportunities for growth, safety for our children and our families, and of course, quality of life, and access to good health care. I have tried to go through the policy, 56-page document, like you said, but I didn't see enough to make people want to come back. Yes. So maybe in the implementation, we will get to know a lot more.
Okay. So now let's talk about these policies and how different they are from the policies that obtain where you are, or for other doctors who might be across maybe the UK or US. What policies in these countries make it attractive for them to want to go there? I think Dr. Benjamin has already noted for us why Nigerian doctors don't want to stay there. So why do doctors prefer to be outside the country?
So I'll start with myself. I finished medical school, wrote the exams to do residency training, and it was all about who you know, in quote. I knew nobody in Lagos. Unfortunately, I was married and my family was in Lagos, so going outside of Lagos was not really an opportunity, or it wasn't even on the list, because it meant I would be shuttling between wherever else and home. And I tried LASU, I tried Luth, and at some point in one of my interviews, I was told that I'm not from Lagos State. I should go back to where I'm from.
Oh.
I was born and brought up in Lagos. Yes, I lived all my life in Lagos. I don't even know where my village is, where my parents come from. So to be told that for a start was like a shocker that, oh, come, girl, you're not wanted here. So if I couldn't move on to the next level in my career, that was a big issue. And simply because I didn't know somebody or I didn't have the right connections. And I just needed to write exams, and I got accepted here, and I was able to continue my training. So number one, like I said, professional development, training opportunities is a major factor. Why do I have to know somebody in the system to be given a residency placement? Why does that happen? Why is that the case? So first, corruption is a major issue. And I think as Nigerians, if we begin to tell ourselves this truth, the way corruption has eaten deep into our system, even healthcare, it's somewhere to start from, for a start.
Let me come to you, Doctor, here in the studio, Dr. Benjamin, and ask about the policy. Can the policy address, the core issues that we have, that we're seeing in terms of brain drain? You said you've read it page to page, all 56 of them. Can it address the core issue of brain drain? That's the first question. I need to marinate on that as I bring this other question, which is, you said that, they have to think about those on ground as well.
Correct.
So what incentives will be necessary for those that are on ground, the doctors on ground?
So I liked what Nene was saying about professional development. So you finish medical school, you want to go for residency. increase the space, let people come in, obviously. If people come in to do residency, they're more bonded, they have more training, they have more specialized training. That is a core policy you need to do in Nigeria. You talked about increasing the number of medical doctors by doubling the intake of medicines. Now, this is a policy, I had the Honorable Minister of State said it a couple of months ago, that they're going to increase the intake of people studying medicine to universities. But they did not talk about the intake of those that would train them to make them doctors. So you increase the capacity of medical school, no infrastructure, no hostels, no basic training for them, no visiting, no lecturers, no doctors to train them. That's one issue. Number two is you're talking about what is the salary remuneration? How do you plan to increase the salaries? Is it monthly? Is it yearly? How do you, because one of the things that people work for is their take-home pay. I've told them, I've advised them many, many times. Those that give essential services, give them some tax holidays. Let them see that, okay, because I serve in the communities, I serve in rural communities, I take a part of your, I take off part of your taxes to encourage you to stay in those communities. Because Japa is not just Japa outside the country. They're funnels from rural communities, people Japa into Lagos, do like 7 months, save more money, and Japa outside. So people in rural communities also have issues of getting adequate healthcare. So if you think about 200 million Nigerians and only 50,000 medical doctors serving them, that means you have one doctor to 10,000 patients. You don't think about writing policies for people to come into the country. You think about how do we retain those 50,000 not to leave the country again? Salaries, welfare. So somebody says, I want to stay in this country. Back in the days in the early 90s, late 80s, when you finish medical school, you have a car waiting for you outside. You have a mini flat somewhere in the low-cost housing estate that you pay minimum money for rent. But now, even doctors can't even pay their rent. I can imagine you increase the judicial system by 300%. Do they go to a different market? Do they buy different fuel price? So you sit down in your space and say, the judges in this country, or people in the judiciary, they need to get more salaries. But those that keep their health don't get salaries. No, that's not right.
So to itemize this incentive, one of them will be pay increment?
Pay increment, yes. Number two is give them adequate welfare for their housing. Give them car loans. Support private hospitals with 1-digit loan. Create an health bank. If you have Bank of Industry, you have Bank of Agriculture, then as a government, create a bank of health that will now focus only on healthcare infrastructure, healthcare support, and healthcare research. Yes, everything we do in this country, most of the country, all the research we do in this country are gotten from outside. Why can't we have our indigenous research team and we have the most brainy, passionate doctors in the world? Anywhere they go to, they excel. But you're not supporting them here, so you're not creating an enabling environment for them to work. Salary increase, very, very important. Let me give you a story. Commerce salary was increased last year. We've not gotten the arrears since January. Then we're saying, we will do it. Now, if as a country, as a government, you are not truthful to what you are saying, how do you want people outside to come to the country? So they'll just think it's all verbose. You just create the policy again for panache. But are you really truthful about it? I tell them one thing. Government must be true to their word. If you say we have renewed hope, let the hope be truly what? Renewed.
Okay.
And so for the document, the policy from, again, page 1 to 56, does it address the core issue of brain drain?
It doesn't.
It cannot. It will not address it.
It doesn't.
Dr. Nene, you've also read, or you've tried to read all 56 pages. Does the policy say anything about, or does it address anything regarding medical tourism? And I mean now our high-ranking socialites or even politicians leaving Nigeria to go outside the country for medical reasons. Does it address anything in that stead? Does it even talk about perhaps maybe making better infrastructure here in Nigeria, like Dr. Benjamin just noted? You know, there's a deficit of that. Does it touch on that at all? And what could it do in that respect any better?
It doesn't touch on it at all, so far from what I've read. Really, I mean, if I take you back to the earlier question you had asked, and you're talked to what obtains here that makes it attractive for us to want to come here, and then compared to the policy in itself and what else could they look at doing, and the medical tourism that you've talked about. The reason people come here, whether as doctors or whether as patients, is because of access to good professional care, the best actually that is available that you can afford to pay for, and then access to medical healthcare facilities, adequate equipment to be able to treat properly, to do appropriate tests, and to make the appropriate diagnosis. You are only limited as much as you can investigate. If you can do more, then you can potentially say this is what is wrong and this is the way to go. And then, of course, there is that drive to want to do more, to always advancing in technology, the next level of healthcare, the next level of treatment. Of course, if we are not beginning to invest in the structures that we have on ground back home, then we do not stand. We are not at par with these countries that doctors are moving to. A colleague of mine once said to me that, oh my God, when I first moved here, I saw facilities that I only read about in the textbook. And it felt like, oh, they really do exist. And then suddenly you're able to work with this equipment, you're able to do so much more, you're able to diagnose, and you're able to offer that quality of healthcare that we were taught in medical school. So while we are taught a lot of the theories, the ability to be able to put them into practice, we're kind of limited. So if we do not have these facilities and equipment on ground, clearly we are not able to offer the best healthcare. So clearly people would always leave. Unfortunately, the people that leave to access healthcare outside of the country are the people that have got access to funds, because it doesn't come cheap. So I don't know if I've been able to address the question.
Oh, yes, absolutely.
In terms of
yes, oh, yes,
yeah,
you have indeed. And it seems like Dr. Benjamin wants to add a couple here.
Thank you, Nene, for what you said. So there is a machine called PET-CT. I was in Turkey a couple of years ago, and I see people that have cancers get remission, because they get to see the cancer at stage 1. It's called PET-CT scan. It's very, very, we don't have anyone in this country. Now, so you have people that now see their cancers at stage 4, stage 3, where they're going to eventually die. If we talk about medical tourism, and we are sure as a country, as I said, how much are we investing in the infrastructure, the core, that makes the training easy, makes the impact on the people a lot good. People leave Nigeria to go and do radiotherapy in Ghana. So we are taking our money from the country outside because we don't have proper cancer care in this country. The only functional cancer care that I know that is working well is NSI in Luth. How many Nigerians can access it now? And we have increasing cancer. So it's important we put all together, and there's no addressing it. So if you want people to seek healthcare in this country, you address the policy that makes patients feel good to go into the hospital that are owned by government or that are in Nigeria, and said, okay, the doctors are good, but do they have the equipment to make it easy for them to serve us as citizens of this country? Because our right to health is important. 2 days ago, medical students leaving Maiduguri, going to Borno, were kidnapped.
I think it was Benin.
No, they're going to Enugu.
Enugu, okay.
Also between Enugu and Otukpo on Benin.
Yes, Benue State.
They were kidnapped. Do you tell some of them? Yes. So how do you want people to now stay in this country that we are not sure of going home and coming back next day? A doctor was maimed in Enugu. Dr. Popola has been kidnapped for 8 months in Kaduna. We don't know where she is. So those are the things that they're not addressing in the policy. It's important we address the right things so we can be truthful to ourselves as a nation that we are ready for change. It's not rhetoric.
Remuneration, infrastructure,
yes.
But it seems that the number is very specific. 12,400. Is it that they've actually reached out to these doctors, and these doctors are considering why that specific number? Are they sure that these people will come back?
That's why I'm telling you that the policy was written from the outside, not from the inside. So how do you know that you have 12,400 doctors to bring in? So I want you to think about it well, that you are not talking about retaining the ones you know actual numbers by Nigeria, because you have Medical and Dental Council of Nigeria, MDCN, that registers doctors every year, so you can access their data. So you know the number of doctors in Nigeria. But you can't access data from people abroad. It's just speculative. How do you know that you have 12,400 that wants to come to Nigeria? So obviously the policy was written for some people, not for everybody in Nigeria. For me, sir, it's important where we are sincere to ourselves as a nation. We're not serious yet. The budget for healthcare is even very, very abysmal.
Speaking of seriousness and the state of the nation, I think it's very important for us to put into context the type of workload that the current medical staff is going through. So I think, let me ask a question. With the exodus of all the medical doctors that are exiting Nigeria in truckloads, and I don't know the numbers.
Yeah, in planes.
12,000 in planes, you know. There we go, in planes. What is the workload like for doctors? Just to put into context for our viewers at home.
So let me explain to you. I said it before. So a clinic that runs that sees 1,000 patients a day, that was run by 10 doctors before, now is being run by 3 medical doctors. So think about yourself. So you have 1,000 doctors seen by 3 doctors. And the government and the CEO of the hospitals didn't tell the public that our doctors have reduced in numbers because we're not paying them enough. They've left for the other greener pasture. Can you reduce your coming to clinic and stagger the appointment and make it 500 patients or maybe 300 patients to make them being seen adequately and don't kill the doctors? We lost doctors doing ward round. They fell down and they died. A doctor was doing surgery in Benue State University, orthopedic surgery. He was in theater, collapsed and died because of stress. A doctor finished doing 3 CS over the night in a Boeing. In the morning, he didn't wake up on the bed. So there's stress. So people that have underlying medical issues, because of the stress workload, the medical issues are aggravated. Doctors are having kidney failures now. They're having heart failures. Doctors are having issues with their pulmonary embolism. It's important we address the push factor, not only the pull factor.
Well, doctors, we want to say thank you.
Yes, we want to say thank you very much. And Dr. Ajibade, finally, will you come back to Nigeria?
Well, I don't know yet. I'll be sincere.
Please come back.
Let's leave it there. We need you, and whatever it takes.
Come and serve your motherland or your fatherland.
Thank you again, Dr.
I would
Benjamin.
very much want to,
Yes,
but like I said, there is a lot that we would like to see on ground, and Dr. Benjamin has highlighted a lot of things on ground. So,
yeah, thank you once again, Dr. Ajibade and Dr. Benjamin, for being with us here, and we appreciate your presence and insight.
Thank you for having me.